health and wellness is a journey for all of us. We're somewhere in this journey, and it's hard to do on your own. And that's one thing that the program can serve, is that you don't have to navigate it on your own.
We welcome you into a brand new episode of Roane General Hospital's For Your Health. This is a podcast designed to bring some information to the general public about the Roane General Hospital's Prescription for Your Health program. It's an all-encompassing and overarching program to attack health and wellness in Roane County, in the community, and in the surrounding communities. We're here today with a guest that we've had on the podcast before. She's going to change hats, though, and we're happy to be joined again by Kimberly Mertz. Thank you very much for joining us.
Thank you again.
We talked to you as the director of the Prescription for Your Health program, a title of which you deny. You say it's more of a team effort, although you own the title.
It comes with responsibility. I get that. But at the same time, yes.
It's a full team for this Prescription for Your Health.
It's
so
a collaboration.
One thing that is a part of this is all of the help that people will get for this program, meaning you're going to have full access to nutritionists.
Yep.
You're going to have access to dietitians. You're going to have access to fitness trainers, certified fitness trainers. You're going to, again, have access to your doctor and all sorts of other things. And one of the aspects of this is something that you guys have called health coaches. And so no longer will we address you now as the director of the Prescription for Your Health program. We're going to be addressing Kimberly Mertz, health coach of the Prescription for Your Health program. I was looking at some of the things that you guys sent us when we were getting ready to do these podcasts. Yeah. And the thing that got me as a sports nut is the best way to kind of describe a health coach is the health coach is the quarterback of this whole thing. So what I want to do is, number one, I want you to, again, let's rehash your history in getting to Roane General Hospital and getting to be a part of this program. And then I need you to tell us, in your words, what exactly is a health coach?
I might need you to explain to me what a quarterback is.
How much time do we have for this podcast? I got all day for it.
Yes. I think we've already established athletics, and that sort of thing is not my strong
suit. Listen, athletics can mean so many things.
That's so true. What a good point. I love it. So as far as background, I knew, that I wanted to help people. So when I, was looking at programs in college and that sort of thing, psychology is one that really popped out. So I completed a 4-year degree. I have a bachelor's in psychology. And from there, worked in mental health for a while. I got a lot of clinical supervision under my belt as far as mental health. And then, as it was called then, substance abuse. It's now called substance use disorder. And I became certified as an alcohol and drug counselor. And then kind of worked in community corrections for a while as well, too, trying to help people get well. And whatever that means, and with people having different types of challenges in their life. So this program was already ongoing. I was actually a patient of Prescription for Your Health. I was familiar with that. I was teaching yoga one day a week, and after one of the yoga classes in the evening, one of the staff members, Matt, said, "Hey, there's an opening here," because the person in the position previously, Bonnie, had retired from the position. Are you interested in it? And I said, I don't know. I really like fast food. I don't know if I can do that or not. And I knew coming into the position that it was also going to challenge me, myself, and my own wellness journey as well. So previously in psychology, I was trained that we look for what's wrong, and then we try to figure that out and fix that in some way. we're treating it. So we're diagnosing something, giving something a name, and for that purpose, then we're, adapting some sort of treatment. Sort of like when you go to the doctor, they say, "Oh, you have some sort of infection. We're going to prescribe you an antibiotic," that sort of thing. So this prescription for your health is entirely different. This prescription is for helping you to preventatively have a quality of life and overall health and wellness. So, health coaching is, as I see it, it's sort of like rather than figuring out what's wrong, we're going to figure out what's right. So we're going to pull out strengths, what is important to someone, what are their values, and then we're going to build upon those strengths. And it may be really small in the beginning, seemingly. It may be small sort of goals that someone will set for themselves, and then it'll build up over time as well. So
One thing
that's the idea.
I remember in our last podcast that I spoke with you, you said that this program is a very progressive program in that it is attacking preventative things.
Yes.
And so part of that is trying to figure out what the strengths are with somebody, as you said,
Yes.
and then where things can be improved. Again, it's such a forward-thinking program, and a health coach apparently is a very vital role in this. Now, when I hear health coach, that's not, although you're looking for overall health, it's not a personal trainer.
No.
It's not a trainer. What is the difference between a health coach and just a personal trainer?
Right. Yeah, that's a really good question. And the personal trainer is someone who will help with your physical sort of goals, and whatever those may be. So here in Prescription for Your Health, typically that's, where someone's going to medical fitness in the gym sort of setting, or they're in some sort of class setting, doing a group of some sort. And you have a staff member there that is trained as far as, anatomy, muscle stuff, heart rate zones, all of these good things that all are really important components to make sure that your workout is safe and effective for whatever your goals are. So they really hone into that side of things. Health coaching is more so to do with your brain and then also tying that all together. So different topics can come up in health coaching. It may be, someone's relationship with food. They were taught as a kid they must clean their plate, or they got good grades in school, so they went out for ice cream. These are all really, really common things. And then in adulthood, for instance, someone may say, I remember this happening, and I'm trying to figure out why, this occurred and why I have these thoughts now, and it all just kind of ties in together neatly sometimes, or kind of like a mess, really.
Or like a smorgasbord.
Yeah, sure.
So I go back to your history, and you said, at an early age, you knew that you wanted to help people,
right.
and you didn't quite know what that meant at that point.
Absolutely.
Psychology is one of those majors, too, that you hear a lot of people say, I'm majoring in psychology, and they're not really sure what to do with it after that. And so obviously you got into the avenue of helping people in many different forms, be it, drug treatment, whatever the situation is.
Yeah.
And your background is tailor-made to being able to recognize things. And again, it's almost as if you're a puzzle solver. One thing I do remember you saying in the podcast we talked about before was, you said, I'm trying to think exactly how you posed this. It's really nice to be able to help people or talk with people who want to be there,
right,
versus in your previous professional life.
Yes.
Sometimes the people who you saw
sometimes they were
didn't
mandated.
want to be.
Yeah, they were mandated. And in that respect, the goal was just to be a relief to them. That you're human, you're not there, you're there to support them in their best self, and to see that possibility and that potential. So typically here, it is a little bit of a relief that everybody has challenges. We're all human, but most of the people that are coming into Prescription for Your Health have some desire or motivation. Otherwise, they wouldn't walk through the door. And typically that's the hard step, to
Yeah.
walk in the door and say, I think I want to maybe think about some sort of change or some sort of maintenance. Making changes is not easy either. And making lasting changes is not easy as well. So whatever we can do to kind of put those puzzle pieces together along with some support. So that's another thing I really like about the program. We're not saying, here's a free gym membership card. Good luck.
Exactly.
Because we know that doesn't work for people.
Yeah. Now, some people who, again, the fitness center offers paid memberships to people who just want to be left alone
Absolutely.
to do their thing.
Absolutely.
And that's fine. But you're not going to throw these people to the wolves because
Right.
they need support. They don't know that they need all this type of support that they can get. I think of your history again as psychology, and I wonder, health coaching, are there similarities? Are there overlaps? Is it completely different than just being like a counselor or a therapist? Or maybe there's times where you're unofficially a therapist when you're talking with some of your clients. Is there any overlap between that, or is it you try to be a completely separate thing?
Yeah. The health and wellness coaching is a relatively new title. The new field of study is called coaching psychology. When I went through psychology classes, I am unaware that this was even a thing. So
Careful,
I think
you're going to age yourself here.
it's okay. It's fine. I'm cool with it. But it's very relatively new, but it takes in evidence-based practices, evidence-based theories and approaches and kind of puts that all together. And that's how I think psychology should evolve for the most part. We take in new information, we reassess things and say, oh, we can kind of mesh this together and, this may help people as well. So when I went through psychology, it was again, what's wrong with people? What's the diagnosis? So one of the directors in I think it was American Psychological Association, really founded this concept of positive psychology. And that's one of the bases that they use for wellness coaching. So positive psychology is more so the study of overall health and wellness and happiness just in general. So rather than looking at what's wrong, we're looking for what's right, So there is a bit of overlap just because it is the same sort of field. There's another part that's called supportive counseling. I did that in mental health as well previously too, and it's dealing with just day-to-day sort of things. So it's not therapy, it's not counseling. Also, I've had people to say, are you going to psychoanalyze me, and that sort of thing. It's having a meaningful conversation, and people can make whatever they want from that. So, and it's okay to just come in and just say, I don't know that I'm ready to make a change, but I'm here, and that's fine.
Yeah.
We just roll with that and have a conversation about that. There's no pressure to change. Autonomy is another thing that's really important in health coaching. And so that just means that we don't force someone to make a decision, and we trust that they know themselves better than anyone else to make those decisions.
You want to empower them and give them control over their decision making when it comes to that in a situation where they may think that they are not in control of the situation.
They may feel powerless, to some degree.
Well, you're a tremendous segue artist, by the way, because the next question
I think you told Doug that too. But
I did. He is a very good segue art. I will tell that. If you guys have not watched, by the way, our first podcast with Doug Bentz, the CEO, the thing I loved about that podcast was he was Doug Bentz, CEO of Roane General Hospital, for the first 5 to 10 minutes of that podcast. And after that, he was Doug Bentz, patient for Prescription for Your Health. And he was open and honest about his mental journey, his mental health journey, his physical journey, his issue with foods throughout his life. And again, that is something that you guys are attacking full-fledged all the way around. So I do invite people to go back and watch that podcast, because they're going to get I said it to Doug when we spoke about that podcast. I said, it reminds people that you're not just a nameless, faceless guy at the top of the. You're a human being too. a human being who's just like everybody else, who has
Yes.
those struggles,
Right.
who
And
has those
normalize that.
issues. But yes, he was a very good segue guy. Sorry to
Yeah.
get off topic with
Well, no,
you.
I feel like, yeah.
So the segue was, if let's say I enter this prescription for your health program and I request some health coaching.
Yes.
What am I going to expect if I come in to meet with you
Sure.
the first time
Sure.
and then throughout this process?
Sure. Yeah. So the first time, typically, I might be one of the first people that someone meets within the program. And sometimes that's just going through the program, sort of, orienting to this is what you get out of it. This is what you have access to. Check, 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 those sort of things that are really important. And you want to make sure people understand that. And then typically there will be an opportunity where I may say, what brought you to the program? What do you want to get out of this program? That way we can kind of individualize a plan for somebody. Everybody's goals are different. Some people are, they come in and they really know what they want to get out of the program. And then other people are not even sure that they want to be there. They're not sure what it would look like for them to feel healthier, just in general. So we work through that. So typically the first appointment, we will block off a full hour, but it may not take a full hour. And that's based upon the person and what they want to talk about. So if it's a 20-minute conversation, that's completely fine. After that, we do check-ins based upon, that person's needs. The check-in will happen at least every 90 days. That's how it's structured right now, at least. And we allow 30 minutes for that. But again, it may be a 15-minute conversation or so. How are things going? How are you feeling? Are you getting out of the program what you need? Do you need other supports in any way? That sort of thing. But, sometimes those conversations lead into other things, where we talk about different aspects of health. So it could be, my job is really stressful right now. I'm not sure, what I want to do about that. Sometimes as well, mental health will come into play. And so if that were to happen, really, this is not therapy. And sometimes that is a component that can be another resource that can be helpful. And we can help, with that linkage if needed. So, if someone's really, really depressed, and maybe finds it hard to even come in, for an appointment or something like that, then those are things that we have resources for outside of health coaching for that too.
Well, do you find that your background in psychology, your background in this uniquely qualifies you to be able to see that or pinpoint those things, or when does it cross that line into something that you may need to send in a different direction? Is there anything off limits when somebody comes to meet you to talk about when it comes to that?
I mean, we really stick mostly to health and wellness, but that can be taken lots of different ways, family life, social life, all kinds of different things. So it's one of those things, definitely based upon my experience and training, I am able to identify, if someone has some suicidal thoughts, for instance, or just kind of starts, in on those sort of things. Drug use is another thing that I specialized in previously as well, So, and then just mental health in general, crisis situations and things like that. So, I think that my experience is unique in that I can, I've worked with a lot of people that have been in those positions. But for the most part, the health coaching is not therapy. It is not going to talk to a psychologist, or a psychiatrist. And there are experts in those fields that can, kind of pull things together as another resource as well.
Just say, generally speaking, somebody comes in to talk about their health journey.
Yeah.
You're able to, I would assume, let's say, keep the ship on rails instead of letting it go off into some tangent. Now, I'm sure people want to come and just talk.
Yeah, sure.
But you're able to kind of steer it in the direction of, okay, what are the goals still?
Right.
And let's keep trying to navigate that here and there.
Yes.
But being someone that's easy to talk to,
Yeah.
it's easy for people to want to talk to you beyond the regular, beyond the pale sometimes. How do you navigate that?
Well, I think we're trained as well to mine. They call it mining for strengths as well. So if you ask someone, what are your strengths? What are you good at? That's really hard sometimes for people to answer. But if you say, what are your weaknesses? What are you terrible at?
How much time do you have?
Yeah, exactly. And that's kind of human nature to some degree, I think. So sometimes that conversation will seemingly, thoughts kind of are disconnected, but also connected sometimes. And so that is part of the training that goes into wellness coaching, is that you're able to sort of guide. You're not making decisions, and sometimes you have no idea where a conversation is headed. You're just there for the ride. But you are able to pull out some important things. And sometimes you'll say, I remember earlier you said this. And then you start to make some connections in together that are meaningful, because that's sort of the purpose. You want to be a good listening ear, but at the same time, you want it to be a meaningful interaction as well.
Yeah, you want to continue to stick to whatever script they want as far as that's concerned to help themselves, whatever their wellness journey is. Again, there are not so many crossovers to therapy or, as you mentioned, counseling, but you are charged with a very important task, and that is listening to people in their weaker moments, maybe people bearing their soul sometimes in certain ways when talking about, whatever journey they're on. And what are the restrictions when it comes to that as far as confidentiality is concerned for people? And obviously, getting people to trust you is important and not easy.
Right.
So what are the guardrails for that as far as people are concerned? Because there may be somebody out there saying, I don't want to talk to a health coach because they're going to tell people my story.
And it is a small town. I get it.
Yeah. Yeah, my goodness. Word travels fast in this community sometimes.
Yeah, especially by radio. Right? So that's a good question. And I think building rapport is one of those things that we talk about, when we're meeting people for the first time. We want them to feel comfortable, so that's something that we work on together. And it may be, like some people mesh with different people differently. So it may be that I talk to someone and then old Matt White talks to him in the gym and he gets, their life story and they're really comfortable with him. And that's completely fine as well, too. So confidentiality, it's just like when you go to the doctor, or you talk to your nurse or whatever. Everything is HIPAA compliant, with regulations and that sort of thing. When it comes to mental health and substance use disorder, that's another layer, another level as well, too. It's even higher than HIPAA when it comes to confidentiality. Okay. So if those things were to pop out, we would then be obligated to maintain that confidentiality. So we also have obligations, so if, just like in a counseling or therapy session, if we think someone's going to harm themselves or someone else, we are obligated to do something about that and help that individual. But everything, again, is HIPAA compliant, everything just like you're going to see your doctor and all that good stuff. So
again, some of these questions sometimes we think of as, that was obvious, but some people don't know that. And again, the goal for you as a health coach, the goal for you as a part of this program is to knock down those barriers that people may have to stepping through the door for the first time.
Right.
And that question of, if I tell anything, is it going to get out?
Right.
No, it's not. It's confidential, and it will stay confidential, and it's just a part of the process that you guys have to trying to build this overall health and wellness program. Yeah. Let's talk about health coaching. What would somebody be expecting to gain long term to being with a health coach? This, I imagine, this is something that goes throughout the year of the program, if people so choose.
Yes,
it's a portion of it, and if people want to re-up again, they could continue with that. Yeah. So, what are the things that people can expect to gain from having a health coach like yourself?
A lot of people I hear struggle with accountability and structure and motivation just in general. So that's one thing that health coaching can serve if someone wants it to. So we can kind of look at, small goals. Let's try this for a week. Let's just experiment, try this for a week, see what happens, and then we'll kind of revisit it. And then once a person starts to meet those small goals, sometimes they add up, and then it creates a bigger change for them and how they feel. Maybe they'll have more energy, whatever it is. So it's those small changes that really factor into making a potential lifestyle change if that's what someone wants to do. Again, um, you're your own driver in this whole prescription for your health. Yes, the doctor prescribes it and they have a plan of care, but you have a full autonomy in making choices for yourself as well. So that is kind of a big thing, that you're able to make those small sort of changes. And then those add up to some sustainability as well. On the flip side, we know health and wellness kind of has ups and downs. So we are also here to support those downs rather than, judging someone or criticizing someone. Hey, you haven't been here, in 2 months. What's going on with you? That sort of thing. We're checking in with them. Are you okay? What's going on? Do you want to talk about this? Just to kind of guide them and support them, because we've all been there. We're all human. Health and wellness is a journey for all of us.
Yes.
We're somewhere in this journey, and it's hard to do on your own. And that's one thing that the program can serve, is that you don't have to navigate it on your own.
Well, Kimberly Mertz, said you didn't know how, but you wanted to help people.
Yeah.
And now you're in a unique position to help people. I hope that this works out very well. Already, as we said, there are some success stories involved in this. I hope that the general public who watches these podcasts, if they even had a thought in their head that they wanted to start this journey, and again, as you said, there are so many avenues for this journey. It doesn't just mean you got to go to the gym right away.
Right.
Somebody may want to see you first.
Yes.
And find out, what in the world do I do to get started?
Sure.
Well, you wanted to help people, and here's the position you're in to help people. And I hope,
Maybe.
I hope that it works out very, very well. I know that you're a good listening ear, obviously, and I do hope that people who are in this program take full advantage of you as well as a resource for this journey that they may be on. And it's a lifelong journey, as you said. It's not as if they're going to come see you for 3 months and never see you again.
Right.
It's an opportunity for people to get the resources they need to help continue to navigate this thing called their overall health and wellness.
Yes.
We appreciate you again for joining us for another 30-minute session. We hope, as these podcasts go by, that we get the chance to talk to you again, maybe in a different avenue.
A different hat.
I was going to say, you've got so many just different hats you can wear. We'll find out another one.
It's a small town.
We'll bring you back in for that one. In the meantime, Kimberly Mertz, thank you so much for the information that you provided. Thanks for being a part of this Prescription for Your Health program. And if anybody has any questions, all they got to do, right, is come see you all.
Absolutely.
It'll be great.
Love it. Yeah.
100%. Thank you again, folks, for tuning in for our For Your Health podcasts. For Kimberly Mertz, our health coach and director of Prescription for Your Health, I'm Andrew Miller. Have a wonderful day.